Good afternoon, everybody. Thank you for joining us. We're going to wait just about a minute to let other people hop onto the webinar. I appreciate everybody's patience. All right, so we're going to get started because today is a big topic of security over compliance to kind of wrap up this month of National Cybersecurity Awareness Month. Just a little bit of housekeeping before we get started. Today's session is being recorded and you will all receive a link to the recording at the end of the webinar. Also today we are very fortunate. Our webinar today is being sponsored by ThrottleNet. ThrottleNet is a partner of HIPAA and we're very excited that they partnered with us this month for our webinar. At the end of the webinar, I'll give you a little bit of information about ThrottleNet and what they can possibly do for you guys as well. Also, everybody's lines are muted. If you have any questions throughout the webinar, please feel free to utilize the Q&A button to ask any questions at any time. So let's go ahead and get started. So we all know that healthcare is under attack. In fact, we won an award last year, but not an award that we want to win. We are actually the most hacked industry in the United States. A lot of this is because hackers know that we are not taking security as seriously as we should, as well as the value of all of the medical records that are in there. On average, a medical record is worth 10 times the value of a stolen credit card on the black market, which just leaves us extremely vulnerable. In fact, hacking has surpassed all other types of breaches in healthcare. And the majority of the times, a hacking event will affect more than one location. This is because a lot of times we're being phished. So we'll get the attack delivered to us through an email, and then it can spread throughout our networks from there. It is also important to note that most cybersecurity attacks are preventable. So we're being attacked, but there are things that we can do to actually help protect ourselves, and we're going to talk about a couple of those today. One of the biggest things that might surprise you is the majority of our attacks are coming from overseas. And so a simple little blocking of foreign IP addresses can actually help do a lot of good to protect our networks. So why exactly are we vulnerable? The number one reason why healthcare is vulnerable is because security is not viewed as critical to patient care. So this means that we're only on average spending about 6% of our operating budget on security practices. And this is because it's not seen as critical to patient care. But would you be able to still treat your patients if you didn't have access to your network, to your EMR, or if your entire computer was, or your entire system was locked down to ransomware? So we can see that security really is critical to patient care, and we should be taking it a lot more seriously. Another reason why we're so vulnerable is that shortcuts to adoption of technology in healthcare is seen as culturally okay, meaning it's okay if we don't take the necessary steps to properly vet vendors. So we can use vendors that actually will, that they won't sign business associate agreements, or they won't answer security questionnaires, or we're not sure what their practices are. We also will allow our mostly clinicians to share passwords so that their medical assistants and other assistants can actually log into the EMRs and to their workstations for them to save them a few seconds when they're going from room to room. And this is a big problem. And the third reason is budget. Tech is just expensive. It's expensive to adopt, it's expensive to maintain, and healthcare their budgets are shrinking and the expenses are getting larger. And so we cut expenses, and technology is one of the places where unfortunately a lot of healthcare organizations do cut expenses, which leaves us ultimately vulnerable. We also have weak or missing security measures. These are three of the most common ones that we see when we come in and do security risk analyses. We see lack of authentication. So we have weak password policies is probably the number one reason, and your passwords are actually your weakest form of protection. A password can be easily breached or hacked. There are password cracker software out there that hackers use to get in through passwords. And if we don't adopt stronger password policies, we're left vulnerable. We also have seen a lack of adoption of two-factor authentication. So two-factor authentication is when you have a password that you enter in, and then you have to swipe a card, or you'll receive a text message and you have to enter in a code. So it's essentially two ways to authenticate yourself into a system that has access to PHI. We're also not properly encrypting our data at rest. So we'll talk a little bit more later on about some encryption practices, but encrypting your data at rest, not just your data in transit, is super important. In fact, it could actually benefit you if you are hacked or you do have a breach, if you can prove that your data at rest was encrypted, because essentially that would mean that the attacker would have had little access to, if any, to PHI. And then this is mostly for clinics where we see use of insecure email, where we see free or personal email accounts being utilized to share PHI. So these are your Yahoo, Gmail, and AOL accounts. We'll also see shared email accounts where one practice will have a single email for everybody to utilize and share, which also leads into unencrypted email. So when you do have PHI that you're sharing back and forth, you are required to have that encrypted. And then email access on mobile devices, and this goes across the board for organizations of all sizes and types, because most of us have smartphones where we have our work emails on, and we have our work emails on our smartphones, and if we're not encrypting our smartphones, or if we don't have some heftier securities on our personal devices that have access to our work email, it's leaving us vulnerable for those types of attacks. We also see a lack of comprehensive inventories. And this is really important, right? So this is not just your hardware. This is a comprehensive inventory of all of the software that you use that has access to, can transmit, or stores or creates PHI. It's really important for you to have a solid understanding of everything that you use that can have access to PHI, and that it's all documented. We also see lack of basic security protocols. So SSL and TLS on websites and applications transmitting PHI is super important. So one of the first things that we always do when we do a security risk analysis is go onto the website and see. And what we see a lot of times, and again, this is especially for clinics, we see the clinic website and it has no SSL or TLS. We can tell that it's built like on WordPress or Joomla, and it has these free these contact us forms on there, right? We all know what I'm talking about. You've seen them like on websites where it's a form directly on the website that you fill information out on. And so even if your website has SSL or TLS, those web forms are actually plugins that are provided by Joomla or WordPress. And so they're going through a third party. And so all that data is going to that third party where there's no business associate agreement, and then back to the provider or to that clinic or to the hospital. And it's all being transmitted in clear text. And so we never want to have those types of things on our websites, because that's a huge security breach, and we see it all over the place in healthcare. And then lack of data backup and disaster recovery planning. And this is super important. So if you have a breach and you're only backing up your data at the end of every day, can you survive losing an entire day's worth of work? And if you're at a larger clinic or a hospital, you have to think about the fact that you're losing so many people's days work. So it's really important that you have incremental backups throughout the day. I know at HipAAATrek, we back up our data every 15 minutes. So we'll only ever lose 15 minutes of work. That's the maximum we can lose. And then we have a tested disaster recovery plan, and that's also really important. So just having a disaster recovery plan that you have written down, if you've never tested it, how do you know it works? How do you know that you'll be able to recover your data and get back to work within an appropriate amount of time that will make sure that you're losing the least amount of revenue and patient care as possible? The only way to be able to tell that is if we're testing out our disaster recovery plans frequently. We also see a lack of auditing and monitoring procedures. So this is probably what every compliance officer hates the most, is actually going in and auditing everybody's access to make sure nobody's accessing things that they shouldn't be accessing, and that we're properly monitoring our systems. So some of this can actually be set up to be automated, and I really strongly suggest that because it reduces some of the work. But unfortunately, some of it's still going to be some manual type labor of going through your EMR especially, and making sure that nobody's accessing things that they shouldn't be. And that is your responsibility, and it is a huge ability for you to be able to protect yourself. Another thing is we treat our work environment like our home environment. So this is one of my favorite pictures, is it kind of encapsulates everything that kind of drives our IT departments crazy, right? So our IT departments put every piece of data security in place, right? So in this image we have, in this corner, we have firewalls, encryption, antivirus software, and in this corner, we have Dave. So Dave is our human error, and he causes so many troubles for us because it doesn't matter what we do, Dave is always there, right? So some of the things that we need to make sure we're teaching Dave is proper computing habits, right? So it's called a workstation. It's not your PlayStation. It's not what's at home for you to mess around with. So when we have improper web browsing, we're utilizing our own personal email, and we can go on social media at work. And these are all things that can cause damage to your work environment. So I would say about 80% of the places that we go to when we do our security risk analyses, we can find that we see employees actually looking at pornography at work. So make sure that you're blocking everything that you can to protect yourself against Dave in that situation. Dave also really wants to know what type of Disney princess he is. So he spends quite a bit of time on Facebook and BuzzFeed trying to figure that out. And so not only is that wasting his productivity, it's putting your security at work at risk. Dave is also really bad at physical security. So he leaves his workstation unlocked and unattended when he gets up to get a cup of coffee or go to the restroom or just run into somebody else's office super quick. And that actually can cause some damage too, because Dave is still responsible for all the activity that happens under his login. And if he forgets to log out, anybody can actually go through and look through that. And even leaving mobile devices in vulnerable areas. So we know that mobile devices that contain PHI are probably our biggest risk. These are our laptops, tablets, and cell phones. And when we leave those in vulnerable areas, they will be swiped. So we make sure we're keeping those under lock and key. And then just lack of regular security practices, where we don't have proper passwords in place. We may have an internal firewall, but we've neglected to put in an external firewall. And again, those pesky audit procedures, those will keep coming back to us. We have to do those. We also tend to ignore our non-technical vulnerabilities. And this is probably one of the biggest problems that we see in security, and that is because we think of security as an IT function. And there is a lot of non-technical vulnerabilities that we also need to consider when we're considering the security of our electronic protected health information. And so one of the biggest things that we need to do is we need to make sure that we have cross-functional teams, because when you tell your IT department that they're responsible for security, they're only going to think about technical vulnerabilities. So what are non-technical vulnerabilities? They are the physical security of everything. So our portable devices, anything we do storage, and all of our maintenance records. We also have our employees. Again, this goes right back to Dave, right? So Dave is really pesky, and if we're not paying attention to him, he can cause us some really big headaches. So we need to make sure that we've trained all of our employees before we give them access to our protected health information. We need to make sure that they're trained periodically throughout the year, and that they receive training every time one of our security or privacy practices changes, so that they have the most up-to-date information. We also need to make sure that we're properly hiring. So this means we're training our employees before we give them access to protected health information. And we need to make sure that we're properly terminating our employees. So whether or not they resign or they're being fired, we need to make sure that we have an accurate list of everything that they have access to, and before they leave our facilities, that all of that has been terminated. So that is not only considering like technical passwords and computer systems that they need to be locked out of. It's also what physical locations. Do we need to change punch codes to doors? Do we need to change locks? Do we need to just get a key back? And some of that's going to determine like the level of employee that's being terminated, as well as whether or not you feel like they will have any malicious intent towards you after the termination. We also need to make sure that our policies and procedures are more than just a binder. So you need to make sure that your policies and procedures are living, breathing documents that you're actually implementing. Because if you just have policies and you're not following them, that's a huge vulnerability. And finally, we need to look at our third parties. So any vendor that we have, we need to evaluate whether or not we need a business associate agreement with them. We need to see, can we do a security assessment of all of our third parties, or get some other sort of assurance that our vendors are secure? Because a third of all cybersecurity attacks involved third parties. Now that's all cybersecurity attacks, not just specifically to healthcare, but that is hugely alarming. And so we need to make sure that we are taking it seriously and properly vetting our third parties that we utilize. And so finally, the best defense is a robust security program. So if we focus on security, compliance will follow, right? So one of the things that we need to really understand is that HIPAA is not a security framework. It is a regulation. And so it does have some requirements that fit into the security framework. So this is the NIST cybersecurity framework. However, it doesn't go in depth. It's left purposely flexible to fit organizations of all sizes. And so it is our strong recommendation that you adopt a security framework. You can choose NIST, which is the National Institute for the Standardization of Technology. It is a government written security framework. So this is the framework that is recommended for the DoD. So there is no framework from NIST for healthcare, although there is a NIST crosswalk from NIST to HIPAA to help you guys out that I'd be happy to share. If you guys are interested, just let me know, and I'll be happy to send that out to you. There's that, but there's also a high trust security framework, and there's ISO. So there's other frameworks, but this one, I tend to like the NIST framework better. It's the easiest one to understand. So we're going to go into a few of these. Don't worry, we're not going to go through all of these sections today, but this is what the NIST security framework looks like. And one of the things that we really need to make sure of is that we're including all of our cybersecurity, or all of our devices that are connected to the network, in our cybersecurity plan, right? So that's probably the first thing that we need to do, and that's regardless of which cybersecurity framework that you're looking at. And so this is anything that's connected to the internet. So at the last WEDI work group for HIPAA last year, there one of their biggest recommendations was that we start looking at our connected devices. So all of our monitoring devices and our hospitals that we don't typically think of when we're doing our security risk analyses that are connected over the internet or on our network, because those are the next entry point for hackers to get into our systems. So we need to make sure we start looking at those, like our MRI machines, any of our patient monitoring systems, any other type of imaging systems that we may have that get connected to the internet that contain PHI. We really need to start looking at those as the next entry point for cyber criminals to get into our networks. One of the biggest reasons why those connected devices are a growing security concern is because a lot of them work off of unsupported operating systems. So, for example, we were just doing an assessment at a pharmacy where they use a piece of McKesson software, well, to run some of their machines. Well, they can't get off of Windows XP because that's what McKesson requires that to work off of. Windows XP is no longer supported by Microsoft. And so they have an unsupported operating system that they have to have, and there's no other alternative out there. And so they have this huge risk and liability out there, all because that system is on an unsupported operating system. And McKesson's a lot bigger than these hospitals and pharmacies. And so you have to make sure that we're all kind of pulling together to say, hey, we need you to actually use supported operating systems to protect the cybersecurity. We also know that our connected devices aren't all included on our risk analysis and security evaluations. So not understanding that risk means we can't communicate that concern back to our vendor, and we can't start taking the necessary steps to move away from the vendor or try to find some other workaround or alternative to help address that gap. We also know that these connected devices don't necessarily support common security protocols. So a lot of times you can't have a unique user ID and password to authenticate yourself into some of these systems. And so it's a shared password, or even worse yet, there's no security at all. We know that these connected devices store rich electronic protected health information. It's got all the patient's data. It has everything that they need to steal that, like a hacker would need to steal a patient's identity, are stored in some of these connected devices. And they're so easily breached and with a low likelihood of immediate discovery, which means that attacker can just keep farming from you without you even knowing. So some of the things that we can do is make sure that those connected devices are on our asset management, right? So here are some action steps that we need to take when we're thinking about how we're going to manage our assets. We need to make sure that we're identifying all of our devices, workstations, mobile devices, personal devices, laptops, tablets, anything which access, stores, or transmits electronic protected health information. We also need to make sure that we're identifying all the software that we use to create, access, store, or transmit electronic protected health information. And then we really need to make sure we have our data and our application and data criticality analysis. So it sounds like a huge mouthful. It's actually super simple to get your application and data criticality analysis together. Again, I have a great template I'd be happy to share with you guys. Just let me know if you want that template. At the end of the webinar, my email address will be there, and just let me know. This application and data criticality analysis is required. It's part of the contingency plan of the HIPAA security rule. So we know we have to do it, but it's simply just listing out which software you have, what softwares that software needs to run on, right? So if you're using, Microsoft Office, you need an operating system to support that and then you need to know what your recovery point objective and recovery time objectives are. So what point in time do you need to go back on? How long can you go without that? And then what are any potential workarounds so that you can actually get that? So just got a question. So does this mean that we need Windows 10 by January 2020 to be secure? And that is correct. Windows 7 is no longer going to be supported. It's being sunset. And then we also need to make sure that we have all the proper controls in place. So these are all of your policies and procedures all around your assets, right? And this is all because G.I. Joe was right. Knowing was half the battle, right? And so the best way for us to know what's going on is to conduct a security risk analysis. So these are the steps that will need to be taken to do a security risk analysis. We did a webinar a few months ago on security risk analyses. If you missed it and want a link to that, please let me know. I'd be happy to send it to you so you can learn more about these steps. But the biggest thing that you need to know is to take a multidisciplinary approach to doing your security risk analysis and to your security program as a whole. So most of us think of security as being in our IT departments, but our IT department's unable to tell us the financial impact that a breach could have on our organization. That needs to come from finance and operations. They can't tell us our legal risk. That needs to come from legal or compliance. So you need to make sure that you have a multidisciplinary approach to not just your security risk analysis, but your security program as a whole. So some risk management action steps that we need to make sure that we're doing is we need to prioritize all of our identified vulnerabilities. So when we run our risk analysis, we need to prioritize which vulnerabilities we're going to address first. And then we're going to create a project management plan for each vulnerability that will be mitigated. This is incredibly important because just knowing what your vulnerabilities are without a plan to mitigate them, it doesn't mean all that much. Again, use that multidisciplinary approach to mitigation and document everything. Everything needs to be documented. And you also need to remember that risk management is an ongoing process, not a one-time thing. Okay, at the end of the service. Okay, that sounds great. Thank you. Okay, so oops. So access control. This is another big problem that or another big area that gets us into trouble, right? So we need to make sure that we're establishing access for our employees and our workforce members correctly, right? So establishing work groups so that we can know that nurses need access to these certain things and management needs access to these certain areas, and making sure that we actually review those periodically and making sure that those are still proper is really important, because we have to comply with the minimum necessary rule, which means you can only have access to the minimum amount of PHI that you need to do your job, which means we may need to set up periodic reviews of the access, because we may need to modify the access if someone's job has changed to ensure that they still have the proper access that they need. Yes, I will be sharing the PowerPoint at the end along with a link to the recording. So encryption practices. This is my favorite thing to talk about, right? So a lot of times we know we have to encrypt all of our data in transit, and for the most part, we do a pretty good job of making sure that all of our emails are encrypted. We're using encrypted electronic medical records. We have all of our cloud-based data backups. That's all encrypted, all in transit. But sometimes we forget about encrypting our data at rest. This is the data that's sitting on our workstations or sitting in our servers, and we need to make sure it's encrypted. And there are two ways that most of us will encrypt, right? Full disk encryption or file level encryption, right? So full disk encryption is by far the easiest, the one without the most hassle. People love it because it doesn't require long keys to access files, and a lot of times it's free because it's free with Windows Professional. So everybody loves it. The problem is with full disk encryption, it's only encrypted if your machine is unbooted or turned off. The moment you turn your machine on, it's no longer encrypted. And anytime you're moving files, those are also not encrypted. So if you're moving a file from one folder to another folder, they are decrypted. So with file level encryption, it is the strongest level of encryption. It stays encrypted regardless of where it's stored. It's encrypted as long as it's at rest, meaning even if the computer is on, the file is encrypted unless you're actively utilizing the file. So there are a couple ways. So I wouldn't say that all of your machines need file level encryption or all of your machines need full disk encryption. You need to come up with a system that works best for your hospital or your clinic or your organization to address this. My strong recommendation is that every mobile device, so all of your laptops, should have file level encryption on there. It helps protect the system better, it helps protect the data better, it ensures that all those files are encrypted. And full disk encryption is perfect for your workstations or your servers. All of that's fine. So maybe try to work with your IT team and come up with a hybrid of how you can address encryption. One of the biggest don'ts is don't send unencrypted communications containing APHI. So this is text messaging, which that's probably one of our most popular questions we get is iMessaging encrypted? Can I use it? Is it HIPAA compliant? The answer is no, it is not. Apple is not signing a business associate agreement with you. You cannot text patient information at all. And then email, you need to make sure that you're using an encrypted email and that you have a business associate agreement in place with your email provider before you send PHI through email. All right, so now we're going to talk about information system maintenance. So outdated technology on average costs the health industry $8.3 billion a year. This is an insane number. We could treat so many patients with that dollar amount that we're wasting on outdated technology. And a lot of this is because we don't want to update our machines. It's expensive and it's time consuming, and let's face it, nobody likes to change, but we have to make sure we're doing that. And it's going beyond just updating our operating systems and our physical hardware. It's even just as simple as patch management, right? So these are all of the updates that we have to do to our current operating systems. You know, you get those little alerts, those little pop-ups that say you need to update your system. And Microsoft and Apple send those out a lot. And those patches are super, super important. So if we think of those patches, like, so if you have on a pair of jeans and you have a big hole in those jeans, that patch is covering that hole. So it's covering that vulnerability to protect yourself. And the patch for your computer is the same. It's patching up that hole in the operating system to protect your systems and your networks from attacks. So it's really important that we have a strong patch management and we automate it as much as possible. And we assess any legacy systems. We know that there are some systems out there that still require us to utilize outdated technology. So we just need to make sure that we're constantly reviewing those. Oops, my bad. We also need to make sure we're cleaning our machines out, right? So temporary files, especially like your email temporary files, your recycling bins. So attackers nowadays, like they're attacking us through rootkits, botnets, and all of that, and they're storing all of that information in our temporary files and recycling bins. And if we're not clearing those out on a regular basis, and you can set rules in your machine or have your IT department set up rules to have those automatically cleaned out periodically, but we have to make sure that those are getting clean. Number one, your machine will operate faster because you're cleaning up memory. Number two, you're helping to protect yourself in case you have any type of malware hiding in those temporary files or recycling bin so that you can get those out. And then older technology, they run slower. We can have loss of productivity and therefore revenue. They have a higher prevalence of cybersecurity attacks. They're less likely to be supported by the manufacturer. So we really need to review and make sure that we're updating all of our technology as necessary so that we're not using a bunch of old technology. And then early detection saves data, right? So just like early detection saves lives when we're doing our cancer screenings and diabetes screenings, renal screenings, early detection within your software can actually save your data because your data is valuable and we need to protect it. So we need to make sure that we're using proper detection software. So never use home versions of detection software. So if you have Norton antivirus, never use the home version of it. Always use an enterprise version of a detection software. Also, make sure that you're keeping the detection software libraries up to date, and that you review your quarantines frequently, and you disallow users from disabling your detection software. We actually see this more frequently than I thought we would, where people will turn off their antivirus or anti-malware because it's annoying. They get those little pop-ups and they don't like them, and so they'll just disable it altogether. So you need to make sure that your IT department has complete control over that, and that individual users aren't able to disable the antivirus software. And also you need to make sure that it can scan your root folders. So this might mean that you'll have more than one type of detection software to make sure that it's scanning everything, because no detection software catches 100% of everything. But if you run one or if you run 2 or 3 different types of detection softwares, you'll likely be able to catch the majority of threats out there. So employee training. Again, this goes back to Dave, right? We need to make sure that we're training Dave, and we need to make sure that he knows how to recognize a potential attack, right? So one of the first things that we want to look at is slow moving machines, right? So when our computers start to slow down, we might have a Trojan or other type of worm or virus that's slowing our machines down because our machines are having to work harder than normal, and they just start to slow down. And people will complain about the slow machines, and then we don't do anything about it. But if people are complaining about slow machines, we need to take that seriously, because it could be a potential attack, and people need to let us know when their machines start running slowly. Or if an executable just starts running out of the blue, most of the time that's going to happen after we open an email attachment, and it's going to be some sort of ransomware. That executable will be running. We need to educate our staff not only on recognizing that attack, but what to do. They need to be trained to pull the plug to their machine immediately, so that it doesn't spread too far into your network. Also, unwanted pop-ups are another sign of a potential attack. So after we train them on how to recognize potential attacks, we need to instruct them on what to do if they suspect an attack, right? We need to tell them how to disconnect from the network, tell them to unplug the machine or power it off, and then call IT. Because the whole point is to stop the bleed immediately, and then get IT involved. Once IT does get involved, one of the biggest things that we need to make sure that we do is not to panic. If you have an attack and you start to panic, it's just going to make it to where you can't properly think through everything that needs to be done, because you're being very reactive. So this is what we plan for, right? So we have everything all planned out prior to an attack, so you know exactly what to do. So the first thing you'll do is you'll assemble your multidisciplinary task force, right? So you'll have your IT team, your operations, your finance, your legal, your compliance, and they'll all sit down together and start working through the breach. One of the first things IT will need to do is contain the breach or attack and assess the severity or extent of the breach. Meanwhile, everybody else needs to start notifying the patient, staff, and management of the breach, and make sure that you're documenting everything along the way. We also need to make sure that we have a healthy disaster recovery plan so that everything is in place, right? So this goes back to when I was speaking previously about your data backup and disaster recovery plan, and making sure that you test everything. This is everything that we talked about, right? So making sure you have that in place, that you've identified a recovery time objective. That is, how long will it take you to recover, right? So a lot of when you start to ask operations or clinics or clinicians, like, how long can you do without the software? They'll tell you 30 seconds. Well, that's not reasonable, right? So maybe 48 or 72 hours out for everything to be properly recovered. And that needs to be, you need to know what that recovery time objective is. You also need to know the recovery point objective. Now, a lot of time is going to be based off of how often you're doing your backups. A lot of this information is going to be on your application and data criticality analysis. It'll tell you which softwares you need to bring up first in order for that other software to work. It'll also tell you your alternative workarounds for in the event that that piece of software is down. You need to make sure that you're testing this process frequently. We also strongly recommend a separate ransomware response plan. So do you have a plan specific to ransomware? The first question that we have every time people ask about ransomware is to pay the ransom or not to pay the ransom. The FBI warns us against paying the ransom because we're dealing with criminals, right? There's no guarantee you're going to actually get your data back if you do pay the ransom, and it's encouraging criminal behavior. About 80% of all hospitals and clinics that have been the victims of a ransomware attack have paid and have gotten access back to their data. But also that's going to depend on how strong is your data backup and disaster recovery plan. How sure are you that you can actually recover everything that's been locked down? So you really need to understand, what will you do in the event of a ransomware attack? And have you simulated a ransomware attack? Now, this doesn't have to be where you actually lock down one of your machines. You can do this on paper. So you can sit down in a conference room and have a round table with your multidisciplinary response team and work through, what do you do if you have an attack, and work through different scenarios. Work through a scenario where the employee did not unplug the machine, but they called IT and it took IT 5 minutes to get there. And so now your entire network is locked down. And then work through, well, they did unplug the machine right away. So try to work through as many different scenarios as possible so you know exactly how to respond. And employee training on ransomware is not an option. You have to train them. You have to train them on recognizing what it could look like once that executable starts running. You need to train them on how to respond. You need to train them on how to prevent. Ransomware is so prevalent. We have to make sure that we're training on that. One of the biggest reasons is because your data is so incredibly valuable. Again, 10 times the value of a credit card on the black market. And your cybersecurity and compliance programs are the only thing that you have to protect all of that data. So remember that compliance is a journey, not a destination. You have to make sure that you're staying on top of all of your HIPAA requirements, as well as all of your cybersecurity goals, to make sure that you're staying on track and doing everything that you need to. You cannot look at compliance or security as a destination. It's not a checkbox. This is a journey that we're on, and we're on together. So last thing before I let you all go is a little bit about our sponsor today. Oh, and I have another question. So our sponsor for today's webinar was ThrottleNet. ThrottleNet is a managed services provider with over 20 years of experience in providing IT and security services to the healthcare industry. ThrottleNet believes that cookie cutter solutions belong in the bakery and not in healthcare environments. They do provide customized IT solutions to all of their clients. If you want any more information about ThrottleNet, please contact Chris Montgomery. His contact information is there on the screen. So let's see here. Another question, and there's my contact information as well. Is there a way for us to print out the slides to keep on record? Absolutely. So you guys will be getting a, excuse me, a copy of this webinar as well as a link to this recording. So you guys will have all of that for your records, and you can print it out if you want to, save it, share it with all of your friends, and just keep it that's for you. We have one other question. You spoke about file level encryption earlier, which I think we need. How can I get my leadership to take HIPAA security more seriously? That is a big question. So file level encryption is really important for your mobile devices especially. So getting your leadership to take HIPAA security more seriously, really that's going to kind of depend. So have you done a security risk analysis lately? Maybe you can show them the vulnerabilities that you have that file level encryption will actually help to solve. You can, a lot of times though with leadership, you're going to have to show a financial reason why to change something, because nobody likes change. So ensuring that they budget correctly and that they see the value and what you're going to save them and how you're going to help them be risk averse, that's the most important thing. Okay, next question. As a privacy officer, I do not receive cooperation from my security officer to work together and communicate together. Yeah, so we see this quite a bit, actually. So it is important, right? So when we go right back to that multidisciplinary approach to compliance, right? So you as a privacy officer trying to work with your security officer, which I'm guessing is probably in IT, when you're having trouble receiving that type of cooperation, it's probably because you lack a clear plan. So having a clearly documented plan and clearly documented goals with deadlines and objectives to meet will help you guys to be able to communicate better and just be more effective and efficient in your program. Yep, yep, IT department. Yeah. Okay, so any other questions before I let you guys go? I am so sorry we did go over just a little bit today. This was a little bit longer, heavier of a topic, so I do appreciate you guys sticking out with me. If you guys have any further questions, please let me know. Again, my contact information is right there. If you want more information about ThrottleNet, here's their contact information. All right, thanks y'all.